COVID-19 virus cannot be transmitted in areas with hot and humid climates. It's untrue. Regardless of climatic condition, maintain social distancing and adopt protective measures in whichever demographic area you live in or travel or in an area where people have tested positive for COVID-19. The best way to protect yourself against COVID-19 is be frequent hand washing. By doing so, you eliminate viral contamination, if any, on your hands and prevent transmission of infection by touching your eyes, mouth, and nose. Another myth. Cold weather and snow can kill the novel coronavirus. The normal human body temperature remains around 36.5 degrees centigrade to 37 degrees centigrade, regardless of the external temperature or weather. The most effective way to protect yourself against any infection is against social distancing and frequent hand washing with alcohol-based hand rub or washing them in soap and water 20 seconds every 2 hours. Taking a hot bath prevents COVID-19 disease. Your normal body temperature remains around 36.5 degree to 37 degrees centigrade, regardless of the temperature on your bath or shower. Actually, taking a hot bath with extremely hot water can be dangerous as it can cause burn injuries instantly. So it's untrue. Do not practice. The novel coronavirus can be transmitted through mosquito bites. To date, there has been no evidence to suggest that novel coronavirus could be transmitted through mosquito bites. The novel coronavirus is an airborne virus which spreads primarily through aerosol or droplets generated or released when an infected person coughs or sneezes or through saliva or nasal discharge. So this myth found to be untrue. Are hand dryers effective in killing the new coronavirus? Untrue. No hand dryers are known to be effective in killing the COVID-19. To protect yourself against the new coronavirus, frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are clean, you should dry them thoroughly by using paper towels or warm air dryer. Can an ultraviolet disinfection lamp kill the new coronavirus? Untrue. UV lamps should not be used to sterilize hands or other areas of skin as UV radiation can be harmful and can cause skin irritation. How effective are thermal scanners in detecting people infected with the new coronavirus? Thermal scanners has a limited role in screening a person who have raised body temperature due to any cause. It's neither a diagnostic tool to detect any person who may be infected but not yet sick with fever, since the onset of symptoms may occur between 2 to 10 days. Can spraying alcohol or chlorine all over your body kill the new coronavirus? No. Spraying alcohol or chlorine all over your body cannot kill viruses that have already entered your body. Spraying such substances can be harmful to clothes or mucous membrane, that is eyes and mouth. Both alcohol and chlorine-based solutions are used to disinfect surfaces, but they need to be used under appropriate recommendations. Do vaccines against pneumonia protect you against the new coronavirus? No. Vaccine against pneumonia like pneumococcal vaccine and Haemophilus influenza type B vaccine provide any protection against the new coronavirus. This virus has just recently been discovered and a vaccine for the same is still in very initial phase of a trial. So the statement found to be untrue. Can regularly rinsing your nose with saline helps to prevent infection with the new coronavirus? No. There is no evidence to suggest that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There is a limited evidence that regular rinsing of nose with saline to help people recover from common cold. However, there is no evidence to suggest that it prevents lower respiratory tract infection. Can eating garlic helps to prevent infection with the new coronavirus? As we all know, garlic is a healthy food that may have some antimicrobial and antioxidant properties. There is no evidence to suggest that it protects the people from new coronavirus. So the statement is found to be untrue. Does the new coronavirus affect older people or are younger people are also susceptible? People of all ages can be infected by COVID-19. Older people or people with pre-existing medical conditions such as diabetes, heart disease are more vulnerable. WHO advises people of all ages to take steps to protect themselves from the viruses like social distancing and regular hand washing. Are antibiotics effective in preventing and treating the new coronavirus? No. Antibiotics are effective only against bacteria and not against the viruses. The COVID-19 is a virus and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the COVID-19, you may receive antibiotics to prevent secondary bacterial infections. Drinking alcohol can cure COVID-19. There is no evidence whatsoever to support this hypothesis. So alcohol is always injurious to health. A face mask will protect you from COVID-19. That's true. Certain models of professional tight-fitting respirators such as N95 prevents direct transmission of infection. But for the general healthy population, wearing even a single or a double layer mask is not recommended. But any mask can always protect contaminated hands getting in contact with the nose or the mouth. People suffering from any respiratory illness should wear any mask to lessen or to minimize chances of transmission or infecting others. Visit a hospital if you have a cough or fever. Visiting a hospital for mild symptoms during a pandemic increases the chances of getting infected. Exercise, self-quarantine at home. Consult your doctor over the phone and follow their advice. You can avoid the virus by drinking warm water every 15 minutes. There is no evidence to support these claims, but keeping oneself well hydrated is always better. Only people with symptoms of COVID-19 can spread the disease. Untrue. Even people with the COVID-19 infection but no symptoms can spread the disease. Pets at home can spread the new coronavirus. There is no evidence that pets such as dogs or cats can be infected with the new coronavirus. However, it is always a good idea to wash your hands with soap and water after getting in contact with your pets. Tab hydroxychloroquine can prevent COVID-19. Untrue. Do not self-medicate. It can lead to serious complications. ICMR guidelines are limited only for healthcare professionals who are in contact with positive COVID-19 patients. So follow the guidelines. So to conclude, I would like to say, protect yourself and others. Follow these do's and don'ts. Do's: practice frequent hand washing. Wash hands with soap and water or use alcohol-based hand rub. Wash hands even if they are visibly clean. See a doctor if you feel unwell, fever, difficulty in breathing and cough. While visiting doctor, wear a mask or a cloth to cover your mouth and nose. Cover your nose and mouth with handkerchief or tissue while sneezing and coughing. Throw used tissues into closed bins immediately after use. Avoid participating in large gatherings. There are certain don'ts to follow. Have a close contact with anyone if you are experiencing cough and fever. Do not touch your eyes, nose and mouth. Do not spit in public. So at the end, I would like to say that protect yourself, protect everyone. Don't follow the rumors, just follow the guidelines based on evidences. Thank you.